Taking care of your body is essential for living a healthy, confident life. And that includes intimate areas that sometimes get overlooked in mainstream health discussions. The penis is not only an organ of reproduction and pleasure, it also plays a critical role in your urinary system and overall well-being. In this narration, we'll dive deep into 5 essential aspects of penile care that every man should know. Whether you're looking to maintain optimal health, prevent common issues, or simply feel more comfortable in your own skin, these guidelines will empower you with knowledge and practical steps. Let's start with the foundation: hygiene. Proper hygiene is the cornerstone of penile health. The penis, like any other part of your body, is exposed to sweat, bacteria, and sometimes bodily fluids. Neglecting regular cleaning can lead to a buildup of smegma, a combination of dead skin cells, oils, and moisture, especially underneath the foreskin if you are uncircumcised. This buildup can cause irritation, unpleasant odor, and even infections like balanitis. The best approach is to gently wash the penis every day with warm water. If you're uncircumcised, it's important to carefully retract the foreskin and clean underneath, making sure to rinse away any residue. Avoid harsh soaps, scented products, or scrubbing vigorously, as these can disrupt the natural skin barrier and cause dryness or inflammation. Instead, opt for mild, unscented soap if needed, and always pat the area dry after washing. Good hygiene isn't just about feeling fresh, it's your first line of defense against infection and discomfort. Next, let's talk about sexual health and protection. Sexual activity is a normal part of life, but it brings with it certain risks, most notably sexually transmitted infections, STIs. The skin of the penis is sensitive and can present a direct route for bacteria or viruses. Using condoms consistently and correctly is the most effective way to protect yourself and your partners. Condoms not only reduce the risk of STIs like chlamydia, gonorrhea, syphilis, and HIV, but also help prevent unintended pregnancies. If you switch partners or engage in new sexual relationships, regular STI screenings are vital. Early detection and treatment of infections not only protect your health, but also your fertility and long-term well-being. Communicate openly with your partners about sexual health. Honesty and transparency foster trust and safety. Remember, protection isn't just a physical barrier. It's a commitment to respecting your body and those you share intimacy with. Our third essential care tip revolves around regular self-examination. Just as you might check your skin for unusual moles or your mouth for sores, it's important to familiarize yourself with the look and feel of your penis and testicles. Once a month, take a few minutes to examine yourself during or after a shower when the skin is relaxed. Look for any changes in color, texture, or the appearance of lumps, bumps, sores, or rashes. Gently palpate the testicles to check for any unusual firmness, swelling, or masses. Most testicular lumps are benign, but some can indicate conditions like testicular cancer, which is most common in younger men. Other changes, such as persistent redness, sores, or unusual discharge from the penis, can signal infections or dermatological conditions. If you notice anything abnormal or experience pain, discomfort, or bleeding, consult a healthcare provider promptly. Early intervention is crucial. The sooner you address potential problems, the better your chances for a full recovery. Self-examination is a simple, proactive habit that can make a life-changing difference. The fourth pillar of penile care is protection from injury and trauma. The penis is a delicate organ, and while it's designed to withstand normal sexual activity, it's vulnerable to certain types of injury. Sports, cycling, or other vigorous activities can sometimes result in accidental bumps or bruises. Wearing appropriate athletic support, such as a cup during contact sports, helps shield this sensitive area from harm. During sexual activity, be mindful of positions and movements. Although rare, penile fractures, a tear in the erectile tissue caused by sudden or forceful bending, can occur, often accompanied by a popping sound, immediate pain, and swelling. If this happens, seek medical attention immediately. Additionally, avoid using harsh or improvised devices for sexual enhancement or pleasure that might constrict blood flow or cause irritation. Safe sexual practices and respecting your body's limits are key to avoiding unnecessary injuries. If you ever experience persistent pain, swelling, or changes in shape, don't hesitate to reach out to a healthcare professional. For our fifth essential care tip, let's focus on lifestyle choices and their impact on penile health. Your overall health is deeply interconnected with your sexual health. Conditions like diabetes, high blood pressure, obesity, and heart disease can affect blood flow, nerve function, and hormone levels, all of which are critical for healthy sexual function. Smoking, excessive alcohol use, and recreational drugs can also impair circulation and increase the risk of erectile dysfunction. Maintaining a balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports vascular health and hormone balance. Regular physical activity improves blood flow and can help maintain a healthy weight, reducing the risk of metabolic disorders that affect sexual function. Managing stress is equally important. Chronic stress can lead to hormonal imbalances and psychological factors that impact desire and performance. If you notice persistent issues like erectile dysfunction, low libido, or delayed ejaculation, these may be early signs of underlying health problems. Don't ignore them. Consult with a healthcare provider who can help you address these concerns holistically. Prioritize sleep, mindfulness, and healthy relationships. Your body and your penis will thank you. Beyond these 5 pillars, there are a few additional points worth mentioning to round out your understanding of comprehensive penile care. First, don't underestimate the importance of regular healthcare visits. Establish a relationship with a doctor or urologist who can provide personalized guidance and screen for conditions relevant to your age and risk factors. Vaccinations, such as the HPV vaccine, are recommended for men and can reduce the risk of genital warts and certain cancers associated with the human papillomavirus. If you have underlying health conditions like diabetes, it's critical to manage them carefully. Uncontrolled blood sugar can lead to nerve damage and poor healing, which may affect penile health. Mental health also plays an essential role in sexual well-being. Anxiety, depression, and relationship stressors can all manifest as physical symptoms, including erectile dysfunction or diminished pleasure. Open communication with your partners and seeking support when needed can help you maintain a fulfilling and healthy sex life. If you're experiencing persistent psychological barriers to intimacy, counseling or therapy can provide valuable tools for overcoming these challenges. Let's address some common myths and misconceptions. Penis size is a frequent topic of concern for many men, but it's important to remember that size does not determine sexual satisfaction or health. Most sexual pleasure and function are unrelated to size. Confidence, communication, and connection are far more significant factors. Avoid using unregulated supplements or devices that promise enlargement or enhancement, as these can be dangerous and ineffective. Instead, focus on practices that support overall health and well-being. Another myth is that circumcised men don't need to worry about hygiene or infection. While circumcision can reduce the risk of certain infections, proper hygiene is still necessary for everyone. Circumcised or not, regular cleaning and self-examination are essential habits. It's also a misconception that only older men need to worry about sexual health. STIs, infections, and even cancers can affect men of all ages. Being proactive about health is a lifelong commitment. Let's examine the role of sexual activity and masturbation in penile health. Masturbation is a normal and healthy sexual behavior for most men. It does not cause physical harm or long-term issues when practiced in moderation. In fact, regular sexual activity, whether solo or with a partner, can support prostate health, relieve stress, and promote better sleep. However, excessive masturbation that interferes with daily life, relationships, or causes physical discomfort may warrant attention and support from a healthcare provider. Now, let's discuss some common conditions that can affect the penis and how to recognize their signs. Balanitis is an inflammation of the head of the penis, often caused by poor hygiene, infections, or allergic reactions. Symptoms include redness, swelling, pain, and sometimes discharge. Treatment usually involves improved hygiene and topical medications prescribed by a doctor. Phimosis, a condition in which the foreskin is too tight to retract, can cause discomfort and increase the risk of infection. Gentle stretching exercises or medical intervention may be needed. Peyronie's disease is characterized by the development of fibrous scar tissue inside the penis, leading to curvature, pain, or difficulty during intercourse. It often requires medical evaluation and treatment. Erectile dysfunction, ED, is another common concern. While occasional difficulties are normal, persistent ED may indicate underlying health problems such as cardiovascular disease, diabetes, or psychological factors. Treatments range from lifestyle changes and counseling to medication and medical procedures, depending on the cause. Don't suffer in silence. Effective help is available. Let's touch on penile cancer, a rare but serious condition. Early signs include persistent sores, lumps, bleeding, or unusual discharge. Risk factors include HPV infection, smoking, and poor hygiene. Regular self-examination and prompt medical attention for suspicious changes are critical for early detection and successful treatment. Fertility is another aspect of penile health. Healthy sperm production depends on overall wellness, including nutrition, hormonal balance, and avoiding environmental toxins. Excessive heat exposure, such as frequent use of hot tubs or saunas, can temporarily reduce sperm count. Certain medications, recreational drugs, and untreated infections can also impact fertility. If you're planning a family and have concerns about fertility, consult with a healthcare provider for an evaluation and advice. Let's consider the impact of aging. As men age, changes in hormone levels, blood flow, and tissue elasticity can affect sexual function. While some changes are natural, many issues can be managed or improved with healthy lifestyle choices, medical care, and a positive attitude. Staying sexually active, maintaining good health, and nurturing relationships can help you enjoy a fulfilling sex life well into later years. For those who identify as transgender or non-binary and have a penis, specific care needs may arise related to hormone therapy, surgical procedures, or gender-affirming treatments. It's important to work closely with knowledgeable healthcare providers who can support your unique needs and help you maintain optimal health. Let's wrap up with some practical tips for daily care and routines. Start by making penile health a regular part of your self-care, just like brushing your teeth or exercising. Gently wash the area every day, paying attention to folds and creases. Wear clean, breathable underwear made of natural fibers like cotton to reduce moisture and irritation. Change out of sweaty clothes promptly after exercise. Avoid exposure to harsh chemicals in personal care products or laundry detergents. If you shave or trim pubic hair, use clean tools and be gentle to prevent cuts or ingrown hairs. Stay hydrated, as good fluid intake helps support urinary tract health and overall wellness. If you experience itching, burning, or discomfort after using a new product, discontinue use and consult a healthcare provider for advice. When traveling or using public facilities, practice safe habits to reduce the risk of infections. Above all, listen to your body. If something feels off, don't wait for it to get worse. Early action is always better than ignoring problems. Take pride in caring for every part of yourself, including your penis. It's a simple act of respect and self-love that pays dividends in confidence, comfort, and health. In summary, the 5 essential aspects of penile care are maintaining good hygiene, practicing safe sex and regular STI screening, performing monthly self-examinations, protecting the area from injury, and making lifestyle choices that support overall health. When you prioritize these steps, you lay the foundation for lifelong well-being. Remember, health is not just the absence of disease, it's the presence of knowledge, habits, and attitudes that allow you to thrive. Treat your body with care, nurture your confidence, and enjoy the benefits of a healthy, happy life. If you ever have questions, concerns, or uncertainties about your penile health, don't hesitate to speak with a healthcare provider. There's no topic too small or embarrassing, They are there to support you. Open communication, education, and proactive habits empower you to take control of your health and well-being. So, whether you're just starting to pay attention to these essential care tips or you're already practicing them, remember that every step counts. Your body deserves respect and care, and by making penile health a priority, you set yourself up for comfort, confidence, and vitality at every stage of life.